Hey there, sports psych enthusiasts. I'm Dr. Colin Fehr, and I want to share my passion with you. I love talking about ways to unleash the power of the mind. This recording is part of a larger lecture series I've created in an effort to make sports psychology concepts more accessible to a larger audience. The information contained in this series is especially well suited for students of sports psychology and is presented in a way that makes for easy listening for all. Welcome to Sports Psych Concepts.
Hey there, everybody. Welcome to this Sports Psych Concepts presentation. Today, I'm going to talk about eating disorders in sport, and it's going to be a very general, high-level overview or introduction to the topic. It's something that is clinical in nature, and so a lot of people who are working in the sports psychology space don't actually have a license or clinical background to fully treat or address these sort of conditions, but that doesn't mean they don't have a role to play. If they're a mental performance coach or a mental performance consultant and they're working in that capacity, they still have a role to play, and it's very important to have an understanding of the clinical components to these conditions and for the athletes that present with these things. And so just know as I dig into these things, and I'm also going to do some other presentations on this topic or different elements of the topic in terms of, what are some of the impacts that athletes deal with, what are some treatment considerations, what might be some interventions that could be used. My goal is to present it from the perspective of those who are more on the performance end of things, even though it certainly can manifest itself and become clinically significant as a mental health condition. So just keep that in mind. This presentation going to be high-level overview, introduction to some of these things. So let's jump into some of the topics. So I want to start with some background information here, including a definition of what it is that we're going over. And as I alluded to in my intro, eating disorders are serious conditions. And another word that we might attach here is there's disturbances in whatever an athlete's eating behaviors are, and they affect a notable portion of the global population, 2 to 5%. Now, generally, what we see is this impacting more females than males. However, there is the condition is present in a lot of male athletes in particular types of sports. And so it's important to understand these elements and how they might present, but also how widespread it is. Now, it's also associated with some medical and psychiatric complications. Okay, it's not just frustrations with food or body image. When we're talking about clinical eating disorders, and this is on a spectrum, as I'll address later, but it's on a spectrum of, well, here's normal eating, and then we can have overeating on one end, or we go the other direction. We have disordered eating, and then we have a clinical eating disorder. But these clinical eating disorders on that end of the spectrum are complex mental illnesses. So there's serious medical and psychological consequences that are going to significantly impact an individual's quality of life. So important to understand that. And as I said, these are distinct from just some more common eating or body-related frustrations that people may have that may manifest themselves in disordered eating, but they don't meet specific diagnostic criteria. And so the primary types that I'll talk about today are maybe what you've heard of: anorexia nervosa, bulimia nervosa, binge eating disorder, and avoidant restrictive food intake disorder, or RFID is the acronym for that. So let's go through anorexia nervosa first. This is often something, one of the first things that comes to mind when people are thinking of eating disorders. And this is essentially, it involves a severe restriction of food that usually results in a very low body weight. But it's coupled with this intense fear of gaining weight, and then there's a distorted perception of one's body. So someone will feel like they are fat, or they're much larger, much heavier than they actually are. And so there's a distortion where people from the outside may see that person and say, well, obviously you're very thin, and they may think that they're fat. So there's a distortion there, which is a primary characteristic of that. And anorexia nervosa, it has I should say there's different subtypes to this. So you can have restricting type or binge eating and purging type, depending on which elements of the diagnostic criteria that you're looking at. These are all in the Diagnostic Statistics Manual. For those who have more of a clinical background, you can go read around about that. But anorexia nervosa has the unfortunate distinction of having one of the highest mortality rates among all psychiatric disorders, not just those that are related to eating and the types of things that people are putting into their bodies. So some of that comes from suicide. 25% of the deaths of individuals with anorexia nervosa are from suicide. So kind of a sad deal there. Now, beyond just the psychological toll, though, and some of the elements that are there, it does lead to serious physical complications. Some classic examples: just weakened bones or issues with the heart, some electrolyte imbalances there, affects the reproductive system. So a lot of things. It's both psychological and very physical, and then the interplay between those things characterize anorexia nervosa. So now let's talk about bulimia nervosa. And unlike anorexia, individuals with bulimia typically maintain a normal body weight. I mean, it may even also be overweight there. So quite a contrast with anorexia nervosa. But the defining characteristic here is the recurrent episodes of binge eating, just consuming more calories than they need, a whole bunch, followed by some behaviors to undo that and do what was done. I had too many calories. Now I gotta, oh man, I feel bad about that. I gotta get rid of those things. And so that can be a number of different behaviors. Self-induced vomiting is kind of the classic there. It could be excessive exercise, maybe some laxatives or diuretics, those sorts of things. But the way to think about them is they're compensatory behaviors, and they can lead to their own set of medical problems by themselves. So if you think about the acid from your stomach coming up through your mouth or your oral cavity, you can have some dental erosion there, or just the fluid loss. You're losing a bunch of electrolytes that come with that, and that can be life-threatening by itself. But then there's the psychological considerations here. Depression and anxiety are very common co-occurring conditions in individuals with bulimia nervosa. So as we're exploring this as our role as mental performance practitioners, it's important to understand the distinctions between these. So now let's look at binge eating disorder, and then eventually also avoidant restrictive food intake disorder. But binge eating disorder, so what's going on here is that there's just frequent uncontrollable eating, but it doesn't have the compensatory behaviors that we see in bulimia. Okay, so just the binge eating, but then not the self-induced vomiting or the laxatives or the other things going on to compensate for that. And so this is obviously associated with an individual being overweight or obese, and then the associated health conditions that come with that. It could be type 2 diabetes, it could be cardiovascular disease like hypertension or atherosclerosis, those sorts of things. This is actually estimated to be probably the most common eating disorder in the United States. There's an abundance of food for most people in the U.S. and so we have these natural sort of survival mechanisms in our body to eat and self-preserve, and it can be hard to have the self-control when we have so much available. So I mean, it's estimated 10 million people in the U.S. have gone through or experienced binge eating disorder at some point during their lifetime. Now, I want to mention ARFID as well, because I alluded to that before. So this is different than binge eating disorder, and that it's what's driving this, what's just driving these restrictive eating behaviors are things other than body image. So it could just be like someone doesn't like the texture of certain foods, or they have a fear of choking, or some other thing like that. They're just not interested in things, and it primarily affects children. And so that's problematic because it can lead to nutritional deficiencies and developmental delays. And, there may be certain uh, factions of youth who maybe are dealing with some neurodevelopment disorders like autism or anxiety, and it may be a higher prevalence there. But one of the interesting things about this is if you're working with an athlete, say a college athlete, for example, and they kind of present with this and you start to explore it a little bit, the reasons that they have may be more rooted in something that came from their childhood, just a decision. They had one experience with the broccoli and it was soggy and they don't like it, and so now they won't try it even if it's prepared a different way, or whatever, even though they can logically say, yeah, broccoli is obviously a superfood. It's very nutrient dense, but I'm not gonna consume it, even though, I know I need those nutrients for performance or whatever, right? And the reasoning may be rooted in something that occurred much earlier in their in their lifetime. So it's kind of interesting to think about those things because depending on what your background and your training is, may be worth exploring some of those things in session. So I want to move on to another. Basically, it's a consequence of disordered eating, right? Not consuming enough energy, and it may be because of some clinically significant eating disorder, or it may just be where someone is on the spectrum of disordered eating, and that is relative energy deficiency in sport, or RED-S. And there's a burgeoning amount of research on this right now. If you're interested, definitely worth looking into that. But we can describe this as a syndrome that's affecting athletes when they consistently have low energy availability. So that's another term, low energy availability, that is related to this. And there's sometimes that might be okay. We could call that adaptable low energy availability, where it's more mild and there's transient effects, and maybe it helps an athlete actually achieve some of their goals depending on what their goals are, versus a problematic low energy availability, which would be more persistent, which would have more of a persistent physiological and psychological disruption. Okay, so important to understand the difference between those two things. But essentially, low energy availability, it just means they're not consuming enough calories to meet the demands of their intense training. And if they're a high level athlete, they need lots of calories. And so that energy deficit can impact nearly every system in the body, from their hormones to their bones, immunity, and mental health. And obviously that can lead to a decline in their health and their performance. Okay, but it is a spectrum here. Okay, so ranging from the temporary adaptable energy deficits I was talking about to more problematic or long-term deficits there. It can impact both males and females. This was actually born out of, maybe you've heard of the female athlete triad, and that was kind of an original focus around disordered eating among athletes, and anorexia athletica, and some of these different terms that have been thrown around there, but they mostly were oriented toward female athletes. And so that this is a way to sort of zoom out and use RED-S, and it also can include male athletes, because they experience a lot of the similar effects. They're not experiencing the elements of the female athlete triad, but some of the other components they are. Okay, and so there are all of these different detrimental outcomes that come with this. Things like impaired energy metabolism, which is obviously going to be a problem because athletes need to fuel the fire, fuel the engine. But things like reproductive function or just musculoskeletal health, their immunity. Maybe they're more prone to getting sick more often, and things like protein synthesis, their ability to repair their muscles and tissues after they're going out and training really hard, and just ultimately it can impair their well-being, increase their risk of getting hurt, and they're going to have a decrease in sports performance. So none of those things that they are going to want. And as a reminder on this, a lot of where this comes from is there's some sort of fear of overeating or doing too much, and so they'll kind of fuel a little bit, but they're not getting enough because they don't want to overdo it. So it's not like full on clinical significance, but hopefully you can see that relationship to some of the other things I've already mentioned. So to expound a little bit more on why relative energy deficiency in sport and athletes, why red S, why it matters. And, we could actually reframe that another way and say, well, why are athletes particularly vulnerable to this and disordered eating? We could include both of those things. And well, I mean, if you think about the very nature of competitive sports, especially at elite levels, it makes sense. It involves intense pressure to achieve, specific body compositions or aesthetic ideals, and so there's just that sporting environment that's playing a role in that. But there could be pressure that's coming from coaches, teammates, or just even broader societal influences that they might see on social media. Those are the sorts of things that can push athletes toward these unhealthy eating behaviors, and then even excessive exercise. Okay, so historically, as I said, was mostly viewed as a female issue, but male athletes are certainly at risk, significantly at risk. The symptoms may manifest a little bit differently, where, for example, a male athlete may focus more on muscularity rather than thinness. Okay, so that would be like big orexia as a term right there. Muscular dysmorphia would be some other ways that we could characterize that. But it is a widespread concern across many sports, particularly those that are emphasizing leanness or specific weight classes. There's some sort of aesthetic element to that. Like I've heard the term that athletes will say, my body is my business card. It certainly applies in certain sports where that's like a big component of their performance is just how their body type is, and they're depending on what they wear to perform in. There may be more of their body showing than other sports, and so all of those things are important to understand, because the types of athletes that might present to you as a practitioner or to any practitioner, these are things for us to take into account. So what are some of the health consequences of eating disorders and red S more broadly? We'll take kind of a blanket statement here, and obviously there's nuance between these conditions, and so it's not totally going to have complete coverage for everything, but it extends far beyond just weight changes. So that's the first thing to understand, is we're not just talking about, well, they're a little bit low on weight, a little bit high on weight. Like, what else is going on? There's a strong link to co-occurring mental health conditions, as I mentioned previously, depression, anxiety. Those are kind of classic ones. And as I said, eating disorders, especially anorexia nervosa, some of the highest mortality rates amongst all the mental illnesses. And suicide can be a part of that, but cardiac issues are another one. Not consuming enough calories, and the heart is overstressed, and can cause premature death that way. Okay, so for female athletes, there's the female athlete triad, which I mentioned before, just low energy availability. So you have menstrual irregularities or amenorrhea, where the monthly cycle doesn't happen at all. The women don't have a period. And then poor bone health. Now, male athletes will face similar risks like bone density loss and increased injury susceptibility. And then it could actually have hormonal changes as well. There's just going to be different effects on the body with that, because of the differences in hormones. Okay, now One other thing I want to mention on this is that I think it's overlooked sometimes is that these issues don't always disappear when an athlete's career ends. Now, in some instances, they do. Like you can go read up on anorexia athletica and kind of see some of that where athletes display eating disorder type symptoms, but then when they get done with their career, they actually can eat normally and they have a much better relationship with their food. But that's not always the case. Many athletes continue to struggle with their eating and body image concerns well into retirement. So it's not just a matter of, hey, I'm going to help you out now. It really can be impactful over the course of their life. So I want to talk just briefly, because I'll address this in a different presentation in a little bit more detail, but it's important to have a preview of it up front is, well, how do we actually determine whether someone fits the criteria for any of these things? And so I'll just give you the assessment and diagnosis basics here, a few things to keep in mind. Essentially, the first thing to know is that identifying these conditions early is of paramount importance for better outcomes. The challenge with that is that diagnosis is often delayed, especially if you think about this from the perspective of, hey, I'm a mental performance coach, a mental performance consultant, and this is I focus on the performance things. So, and I'm not a licensed practitioner in psychology or social work or counseling, and well, I can't make a diagnosis. That's not what my role is. I can't even go there. And so there may be this delay, even though I may suspect that there's something going on here. So I'm going to refer to someone who can work with them on those particular aspects of it. And I'll stay in my lane to be an ethical practitioner and focus on performance components. But that may slow down this process of reaching a diagnosis. And so having a multidisciplinary team in these situations is really essential. You want to have sports medicine professionals. If you have access to a dietitian or nutritionist, that's excellent. And then you have some sort of mental health practitioner. Maybe the coach may even be involved. It all kind of depends, because there's ethical considerations with confidentiality and all of that have to be worked around and acknowledged. But ideally, we're working together as a group, as a collection of professionals to recognize, different subtle signs and symptoms. And there's a lot of different tools available for this. We can use a clinical interview if that's in our lane, right, our area of expertise and our competence. There's different questionnaires out there that can be used as screening tools, just like initially to say, hey, do I need to use a more comprehensive assessment, or can I move on from this based on my screening? And then physical examinations. So if you got a physician and you got that sports medicine team, that can be part of it. Different lab tests. So many different things. And there's different resources out there. The International Olympic Committee has different resources, other organizations that specialize in eating disorders, lots of different things. So as I said, this is, high level overview on these things, but important to have the awareness as mental performance professionals. So the last main thing I want to really is just preview right here, because this one for sure I'll talk about in a couple of different presentations. But essentially, the primary goal of treatment is to normalize eating, right? To normalize a relationship that people have with food. And that can be a challenge, but we're also trying to address any distorted thoughts they have about food, about their body, and if necessary, if they have some serious weight loss, we want to restore a healthy body weight in those conditions. Now, this is going to usually involve a combination of that nutritional support. Maybe we're using some different psychological interventions that are based in, cognitive behavioral therapy as an example. Medication may sometimes be warranted. Okay, but there's a lot of tools in the toolbox for this. If you're working with an athlete who's an adolescent and they've got an eating disorder family-based treatment, has a lot of good efficacy, great success with that. So there's a lot of options, but I also want to mention prevention here, because prevention efforts really is the best path forward, right? And so if we can educate athletes, coaches, and parents about some of the risks, and then we can foster some sort of supportive, psychologically safe environment in sports to talk about these things and normalize the discussions and the education and increase comfort level of the people who are working with these athletes, even more than someone who is a specialist in mental performance or sports psychology. The coaches in particular are going to have way more hands-on exposure with the athletes. And so depending on the types of things they're saying to their athletes, it really can derail these efforts or it can support them. And so prevention is a big part of that. And then the last thing is recovery. This can be a long journey, and it may involve ongoing support rather than just, well, hey, one and done, or we did this for 12 weeks and we kind of improved, we got to where we were. Like ongoing support may be necessary for even longer than that, depending on the situation. Not always, but depending on that. But recovery, the main thing to keep in mind is that yes, it is possible, and it can be life-changing for those athletes. It can literally put them on a different trajectory, which is awesome to think about. All right, so just to summarize everything, to bring it full circle here, we talked about eating disorders. Remember, different types there: anorexia, bulimia, binge eating disorder, avoidant restrictive food intake disorder. Talked about relative energy deficiency in sport as that related syndrome that ties in quite nicely to the topic. Certainly important to be aware of. And just remember that, athletes are at a heightened risk of these things because of the pressures that they deal with, the sociocultural aspects, the individual things that they're bringing to the table. All of that matters. So the earlier we can identify these things and involve a multidisciplinary team and use that as our approach, we're going to increase the likelihood that we have better outcomes there. And so the best treatment approaches for athletes who are dealing with these things, it's gonna involve all of those people on that team with their different levels of expertise. And our role, it's all about staying in our lane, whatever that is. If we're trained more clinically, we can go there. If it's just more on performance side, we stay there and we refer out. And then lastly, just it can be a long-term process. And so being prepared to provide that ongoing support and be in for the long haul and communicating that with the athlete can be a really good deal. So thanks for listening to the presentation. Hopefully you got something out of it, and you take care until the next time.
Thank you for listening to this recording in the Sports Psych Lecture Series. I hope you learned something. More importantly, I hope you learned something that you can apply in your life. Feel free to share this presentation with others who might be interested. And if you're interested in more content like this, visit the Fehr Advantage channel on YouTube, or find the Fehr Advantage podcast on Spotify, or visit my website at fehradvantage.com.